Startup TV was in Startup Mahakumbh. Uh, I have seen like lot of media houses were there to capture lot of startups. My first interaction with my Startup TV was in Startup Mahakumbh. Uh, I have seen like lot of media houses were there to capture lot of startups because it was the biggest event in India. But
Hello, welcome to My Startup TV. I'm Major Sunil Shetty. We're here other episode of Founder Talk Show live on our platform. If you want to hear amazing stories from entrepreneurs, from founders, do join us every evening 4 p.m. to 5 for a live show. We are world's first and the only media house that provides 360-degree coverage for startups, entrepreneurs, and for the startup ecosystem. Today with me, I have a special guest, Dr. Akhila Kosuru, who's the founder of Augsidius, and she's also a champion for evidence-based medical practice. So let's join in and understand what evidence-based medical practice is all about, and what's Augsidius doing to ensure that to support this. So, Dr. Akhila, welcome to the show.
Sure, for having me on your show, Major. It's my privilege to speak in front of the audience.
So, Dr. Akhila, for people who do not understand what evidence-based medical practice is all about, if you can help our viewers understand what does it mean when you say evidence-based medical practice.
Evidence-based medical practice is a very simple terminology. It is not coming from something in the modern era, but it has been there since way before. What it means is having an evidence backing every decision that is being made in the clinical practice. So as simple as, are we making a call in the diagnosis or in treatment of a patient basing on just a gut feeling? Or is it something that the evidence is pointing out towards? The best of the scientific advancements that have been happening all around the world, we intend to bring it onto the table to the last mile point of care, so that the doctors are able to utilize that and quickly implement it on their patients.
And I mean, as a layman, when we see a doctor write a prescription or suggest, a test or investigations, we assuming that the doctor is banking or is basing that judgment or that call on his learning or her learning, right? And when you add to that is the evidence-based, what you're saying is, I mean, correct me if I'm wrong, what you're saying is, as a doctor, as a medical practitioner, you're looking at various parameters and then making a call, what should be the next course of action for the patient. Is that what my understanding is correct about evidence-based medical practice?
Yeah, so to even simplify it further, evidence-based medical practice, it has a triad. One is the clinical expertise, something that the doctor gains over a period of time from their past experiences on how they have seen the patient respond to it. The second is the research evidence that has been happening all around the world, and these best practices that are brought in front of the doctor to enable them in the decision-making process in this point of time. And the third is patient values. So each and every patient comes with their unique set of circumstances and value systems, how they react to what do they wish to do, how do they want their healthcare to be addressed and all. To bring a harmony between all these three factors and implement every decision, that is thousands of the decisions that are made by the doctors day in and day out. This is what evidence-based medical practice is all about. So it is not just a simple point of doctors' knowledge alone, but it is also taking in the scientific evidence, scientific research into the practice and the patient value systems. So all these data put together is what is enabling in the decision-making process.
Now, let me come back and ask about you as Dr. Akhila. You don't come across, it's not really often that you come across medical practitioners, doctors getting into entrepreneurship. So how did that journey happen? I mean, what motivated you, or what was the reason that got you into being an entrepreneur while you're a doctor as well?
My journey has been very circumstantial, I would say. I've started practicing as an individual practitioner. I have worked with many corporate hospitals, which are very renowned internationally and nationally as well. And with the last 14 years that I've worked with multiple departments and multiple segments, my major focus was into community medicine, where I was playing a role in implementation of digital health practices and to see how digital health practices can help help the medicine and the medical services to reach the last mile. So it to a very remote location, a village, a patient living in that area, how the medicine can reach them, and what is the best support that can be provided through the advancement of technologies has been my forte since the last 8 to 10 years. And during all my journey, where I've worked with thousands of patients and hundreds of doctors, I've always witnessed something that is very, very personal to me, that we always are short of time in terms of when we want to really understand the patient, understand them completely, fully, before even we go to the prescription part of it. We as doctors are always overburdened, and at the same time, whatever support that is available all around us, it is not really helpful to us in terms of getting the best of the research advancements. The knowledge that has been happening all around the world is not coming in very easily to us. Either we have to go into the complete academic orientation and then do a lot of research, spend around a few hours in a week wherein we study and understand, get up to date on the information on the practices that we do, or we give the treatment to the patients in the shortest of the resources and shortest of time possible. So I have personally witnessed a lot of medical errors. As much as 33% of patients facing care gaps and huge medical errors during the entire journey that I've had. So we wanted to really do something to address this before even this occurs. So it's not always the mistake of a doctor when something goes wrong, when it's very easy to point out fingers. Everyone points out the fingers, and patients usually get into a habit of window shopping when one doctor doesn't help. They find that it did not help. They go to another doctor. But what is missing out here is the support that the doctors need to get in this whole equation. And we intend to do that by bringing in the best possible support for the doctor fraternity, and that's what our whole company's vision is all about. So we Augsidius are trying to simplify evidence-based practice in the best way possible. So it is nothing but
And
bringing the right information to the right people at the right time.
with that as a mission, what's the scope of it in India and globally as such? Because for a layman, they don't understand it. I mean, that's my understanding. For a layman, they don't understand. They only look at the doctor, right? Whereas when you, as a health professional, you look at it, for you, evidence-based becomes the key or the cornerstone around which you will work. So, what's the scope for it in India and across the globe?
Scope for this is huge because see, we are talking about healthcare now. We are living in an era where every company wants to become a health tech company or a healthcare company. Everyone wants to do something in the healthcare. Each and every individual would have a need in the healthcare segment at one point of time or the other. But what's happening all around the world is, with a lot of advancements happening everywhere, everyone wants to do something directly for the patient. Some new medication coming in from the patient, supplements. There are a lot of courses available out there so that the awareness that a patient can build for themselves is increasing, and huge support is there. And we as doctors are also trying very hard to educate and make the patients aware so that they are able to take better care of themselves. What is missing in this whole equation is how we can empower the very limited number of doctors that we have to cater to the huge number of population that we are having. And to address this current gap, that is what there are certain companies which are trying to do and help out doctors in this era, and we are one of them. The scope is huge in terms of, if I just talk about medical errors, until unless we call it out, it is not known that medical errors is the third leading cause of death in the developed countries. And this is something that we are trying to address in every way possible. That itself gives you the answer of the question.
So, As a company, as a Oxidius, you provide solution to hospitals. Is that what your model is?
We work in a multi-faceted approach as a startup. So we have multiple products as of now. Apart from conducting the awareness programs and workshops to enable, to empower and educate doctors on the evidence-based practice, we also conduct programs with the medical colleges and take part in a lot of medical conferences where we give them easy tips in terms of how evidence-based practice can be easily implemented. Apart from this, we are taking the support from technology. So we are primarily a tech company. We are building an AI solution. We have built a health intelligence platform, and what we've tried to do is we have trained the machine on understanding the medical logic. And with that, we have trained around 20,000 diseases for the AI to understand and enable the doctors. So from this, powering from this engine, we have created two products. One is Astra, which is an AI clinician assistant. It's like a supporting system. It's a personalized GPT and Google kind of an interface for doctors, which they can use for their personal practice. And the other application that we have is for clinics and hospitals, which is called Clinestra. It is basically for the entire patient journey orchestration. So there are multiple products that are put together in a suite, which is Clinestra, and it is currently deployed for clinics and hospitals. So this is about our products.
We are in a generation where patients, as you said, one is they go window shopping, the second advice or a third advice they want to go. Apart from that, they're banking a lot on WhatsApps, the Instagram of the world, or the Googles of the world to check out. In fact, ChatGPT has joined is the new in the trend where they search out what is the problem and then come. In fact, doctors say this now. People come with printed printed diagnosis and saying, I think I have this problem, instead of asking what is my problem. So in such a scenario, how are doctors adapting to something that you're offering? Because this is they have to move into a different different dimension altogether as a medical practitioner. How are they adapting to it?
So I would like to answer this in two different ways. There are doctors who are tech savvy, and there are doctors who would like to do a conventional practice rather. Altogether, we have seen a lot of awareness being generated around how different types of technology, especially artificial intelligence, can empower and enable the practice. As I borrow from the name of my company, Augsidius, augmentation is what we intend to do for the doctor's practice. So this awareness is building in the medical fraternity as well. And the early adopters are definitely the younger generation, the doctors who are a bit tech savvy, who would like to experiment a little bit more, who would like to take that extra mile to understand how this benefits can be taken in. This is one group that work as an early adopters. But we have also seen a very keen interest coming in from the conventional medical practitioners. But the only challenge here is there is a lot of noise around AI also. It is not necessary that just because we have Chat GPT and Geminis of the world, these have to be, useful for the medical fraternity. There are also a lot of risks that these kind of systems pose. And this is something that medical fraternity is becoming aware of. And that's the whole reason of the complete, a little bit of a challenge that we face in terms of building their trust and, giving them the confidence that this is a solution that you can trust on. The information is not an internet sourced information, but it is a proper literature generated information that you can use in their clinical practice. And this whole it's definitely at an inflection point, but it needs a little bit more effort from all of us, and probably from the peers also, the support system that we have also, and from you also, who is trying to create awareness about all the emerging technologies and what the innovations are doing all around.
So this challenge is applicable to you as a company also, isn't it? Because when we talk about data analytics, machine learning, AI, they're all still in a very, very early stage. And you as a startup will have to really train your model will become better with more data into it. So, which means at this point in time, when you're very early on, the chance of an error becomes quite high. How do you work around that?
Important principle that we consider is irrespective of how much our advanced our artificial intelligence has become, it is always important when we are dealing with life of a patient, when we are dealing with healthcare industry, we always consider that there is a human in the loop. This is a terminology that I'm borrowing from the technology industry itself. It is called human in the loop. So there are a lot of assistants and automations that the artificial intelligence is today providing. But in healthcare and in critical segments, critical industries like healthcare, it is not it is not wise to eliminate the human from the loop and then take autonomous decisions. All the insights, all the intelligence has to be in such a way that these insights are being provided to the human, which in this case is a doctor in the loop. And ultimately, the doctor is making the decision. What we or any other tech player is doing is just enabling with a lot of data processing, which takes humongous amounts of time and computing power and everything. We are trying to give all those things in a platter very easily for the doctors to consume and for them to enable, make a better decision. This is what we are trying to do, and in no way this is trying to replace them from the whole equation, which makes it very, very safe for the patients ultimately.
Recently, I was at at Usmania Medical College for a workshop on thoracic workshop, and caught my attention was where students were sitting in the verandas and on a Sunday, and all of them pretty much had their iPads or the tabs, and they were learning there or reading there or watching videos of the classes probably they would have done a day before or probably a week before. That's the new age or the new generation of doctors are going to come in, right? As you said, tech savvy, their learning mode has changed. It's no more limited to what previously, you would see doctors carrying big books, bulky books, reading through that. Now they get to see, they learn seeing technology, use of technology, maybe just videos for now, but as you rightly said, they're fine-tuned into it, to technology. So something what you're building today, in 5 years' time, where do you think that would be when these doctors, when these students who are in still medical college, when they come, and interact or face your solution?
We are already seeing these kind of young doctors and medical students use our solution as of today. So in our one of the product that I have mentioned, Astra AI, which is the doctor assistant, this application is currently being used by around 550 doctors all over. And out of them, a lot of them are medical students. We are also, collaborating with different medical colleges and giving the solution in the hands of the medical students, help them learn how the subjects, theoretical knowledge that they are learning can be actually applicable in the clinical practice. This whole transition is something that we are trying to enable them on. And yes, like you rightly said, currently a lot of students are going inclined towards the different video-based learnings. There are also a lot of gamification tools that have come in, AR, VR technologies, which is helping them understand the anatomy much better, probably giving them a simulation into the surgical procedures before even they start practicing on an actual patient. There are a lot of tools out there, but we primarily wanted to be the knowledge assistant in the whole journey, and we are seeing that picking up and getting a lot of good feedback in terms of what more features can be added and bundled up together for them to become a better, more enhanced version of themselves, how they can be supported in many ways possible.
So with these 550 odd doctors who are using your platform currently, what kind of impact or feedback has come to you from them in terms of what have you achieved so far as an organization with your concept, and what more needs to be done going forward?
We have conducted a clinical validation study, and we have collected feedback and experience from all these doctors that have been using that platform. And the one metric that made us very, very happy was 85% of the users have told that they are able to make the clinical decisions with more confidence than ever before, because what they have in hand is not just something that just gives the input or generates a text and gives it in front of them, but it is giving the citations from different research articles published and helping them that this is the reason why the decision you have made is the best one, and these are the alternate options available in your patient's the clinical journey. This is how we have seen a lot of confidence building up in the users who are using our solution. And from our enterprise product Clinestra, from the pilots that we have conducted, significant impact that we have seen is 1,300 adverse outcomes were negated because of our solution being present as a clinical decision support system before the prescription was generated. 1,300 adverse outcomes were negated. That itself tells the impact of what could be the future potential of these solutions.
Very true. I mean, 1,300 is a big number when you talk about healthcare. And would you say that the solution that you're offering would be best fit for doctors who just finished their MBBS or who are in their first few years of their medical practice, because that is where the hand-holding is critical, isn't it? Just because you have an MBBS degree does not, because healthcare, like a flying career, requires a lot of practice, a lot of hand-holding before you become that independent doctor who can go ahead and do whatever you're doing, whether you're a surgeon, whether you're a general physician. So that initial stages, that is where you would make it smoother through your technology, because the others, they already have the experience of knowing what is happening. Where do you think it fits in well?
You have brought in a very nice point, Snehal. So the solution Astra as an assistant is mostly fit for the young doctors, as you said. When a medical student passes out and then starts their career, like you mentioned, it takes some time for them to get acquainted with the actual medical practice implementation and all. It's a belief coming in from our seniors that we have learned from, that it takes at least a decade for a doctor to completely, get to the best of their expertise possible, as they have learned from their, seniors and professors and all. So until then, there are some bits of, aspects where there is some doubt or something that is coming in. Sometimes it requires an investigation to solve that dilemma that is there, and where an investigation gives a result, and that would very clearly help rule out certain diagnosis and all. And sometimes there is an advice or a referral coming in from a specialist or a super specialist that might add value to the whole equation. So there are a lot of such support systems that are there today also. But nevertheless, we have practicing doctors who do not have a lot of support systems really available in front of them, and right at this point of time. And at the same time, the time that they have is very, very limited. So we cannot always rely on someone to help us, give a second validation. Everyone, if they are given a second validation with the kind of data that they are generating themselves, it is not another person. They don't need to give a credit to any other person, but it is just their data orchestrated in the right way possible, and then endorsing on their decision. That itself will give them a lot of confidence, and that's the whole place that we are talking about.
Very true. I mean, what you said, a decade is what I mean. Most professions where where there is a direct connect with the people, either life, safety, security, be it the armed forces, be it the medical profession, be it pilots. All of these places you have to have that 2 decades of a decade of experience under your belt before you can be on your own. Also, one of the things that you see in healthcare is during complex issues, multiple doctors need to come together, and super specialists, specialists need to come together and put their heads together. Now, this could be happening pan-India, right? It could be happening maybe a unique case in Africa. Are you working on something where you would be integrating all this information that would come from different places onto a single platform so that, doctors, even senior doctors could benefit?
The health intelligence platform that we have built, that I have spoken to you about, this is coming from the medical literature all over the world. It is not just the national information. These articles, this medical literature is coming from global best practices. And to enable in the better implementation, if a doctor is sitting in India and treating their patient, the first resources or as a reference that they get as a citation in the whole search that they are making is from India, and there are other global best practices that there are shown. So there are levels of evidence that we show it to them, so that from that they can pick and choose the best possible evidence. And what we are doing is simplification and summarization of the entire guidelines and the research articles. That takes a lot of time for them to go through pages and pages of literature. We are giving them in an actionable format. This is the whole point of building our solution based on technology, so that we can scale it in no time. Building intelligence can happen, but scaling it can happen through the enabler, which is the technology.
And what's your scaling plan for your startup? You're going to take it pan-India, maybe multiple states. What's your plan there?
Focus today is to make this solution reach all over the India, all over the nation. But nevertheless, we do have plans of expanding globally as well. We have certain dialogues initiated with some of the neighboring countries in the Southeast Asia, UAE, and certain other countries, where we have initiated a dialogue. And fortunately, we have also gained a couple of users from these different nations who are helping us, modify the product in such a way that it can fit to the particular use case in the country. So the scaling option, how we intend to scale this is definitely through partnerships, through global partnerships. We are already exploring certain partners who are present nationally and internationally, not just for our the network reach and the marketing access, but also to enhance the product further. Our solution is currently being integrated with other health technologies, other EMR systems, and other hospital management systems, so that this need not be considered as another additional software, but can seep in into the current existing solution of the hospitals that are currently being used, and can just help with the intelligence that we have developed. So we have different plans through which we are working on this, and definitely, in single word, partnerships is the approach that we take.
And as Dr. Akhila, you're right now wearing two hats, right? You're two avatars in one, as a medical practitioner, as an entrepreneur. Which is closer to you personally, and how do you balance it out?
Personally, closer to me is me as a clinical practitioner. Never there has been any time in my day when I don't think as a doctor, even if it is a small phone call that I receive from my friends or family. I tend to go into their health aspects and then keep inquiring about the health condition a lot. So that has been, I think it's in my blood now on looking into that perspective. But this, I think my whole, the clinical background is helping me learn on how I can strategize better as an entrepreneur today. How can I position these products that we are building in a better way, so that it can be easily adopted and trusted by the doctor fraternity? Just because I'm practicing day in and day out, I understand the challenges and I am able to better navigate through them. And this is actually giving us a slight, teeny tiny bit of advantage in convincing the doctors on what we are building, and to have them on board that we are not just creating for doctors, but we are creating something with the doctors for the healthcare community. And this whole co-creation aspect is shining because of the dual hats that you mentioned that we are wearing. Not just me, but two of my co-founders also come with blended experience. And just because we are working in a hybrid kind of environment, it is and this kind of emerging technologies, it is very, very important that we are able to communicate well in the interdisciplinary segments. And this is how our previous experiences are helping us.
So very nice, very rightly put across that. Also, doctors. I mean, not just doctors, from any profession. If people come into entrepreneurship, they bring that understanding of that profession, isn't it? I mean, like I came across a army soldier who set up his company and he manufactures accessories that we wear during operations, and he did it because he was coming from specialized forces and he knew exactly where an equipment hurts or pinches, right? So he was building some of the best equipment for the armed forces. Similarly, as a doctor, you know better where you need support. Would you say more doctors should explore entrepreneurship, and if yes, what would be your advice?
All the doctors keep exploring entrepreneurship, we will still be, doing a little less only to the community, because today doctors, I think, have a lot of capacity because of the knowledge and the wisdom that they are acquiring by looking into the patient's deeper understanding about their behavior, about their health conditions. More and more doctors have to step into entrepreneurship to explore what they can do more beyond the regular office timings. I would not say that if a doctor is working 18 hours in a day, the remaining few hours also they should spend on something else. But there are doctors who have probably 9 to 5 kind of jobs, and the remaining time has to be something beyond their medical practice that they can do, how they can use their clinical compounded expertise that they have gained over a period of time can be disseminated across to the younger generations, is the area that I think all the doctors should be focusing. And we have seen that a lot of experienced doctors are currently doing that. They're helping out the younger generations in best ways possible. But we have, as with the help of the newer technologies, like I mentioned, artificial intelligence, which is able to understand one doctor's way of practicing healthcare, way of practicing medicine. This can be disseminated easily, not just through research articles and publications, but through means like co-creation of different AI algorithms and care plans together, working in beyond their boundaries. So this is something I would recommend that all the doctors take up, especially the younger generation, because we see a lot of wasted potential sometimes with the too much of noise happening around the world with all the social media handles and everything. So if these expertise has to be put to better use, and I think that's the way forward.
I mean, even if they don't want to take up full-time entrepreneurship, they could join some of the healthcare startups as mentors, because their insights, their understanding would be a gold mine for entrepreneurs, which they can use to build their or improve their products. So, Dr. Akhila, MyStartup TV, we are a world's first media house dedicated to entrepreneurship, to startups. We provide 360-degree coverage through our web television, where we broadcast 24/7. We cover startups events across India, live broadcast them. We have a digital magazine which comes every month. We do podcast, audio podcast, and OTT. The whole aim is to showcase entrepreneurs and the startup ecosystem. What do you think the kind of work we are doing? What are your thoughts about it?
You are giving a voice to the entrepreneurs who are just starting out. If we are talking about first generation entrepreneurs like us, we do not know how to amplify our voice. And I think, with the kind of work that you are doing, you are helping in amplification of our voice. You are helping it reach, to to more audience, so that what we are doing is gaining that confidence, is coming out there in the world, and this would be inspiring a lot of new generation to take up more such innovative works, and this is going to give them a lot of boost. So I really congratulate you on the wonderful work that you're doing, and also at the same time appreciate and thank you for giving us the opportunity to make our voice be heard as well.
Thank you, Dr. Akhila. Thank you for joining us. Viewers, do join us every day, Monday to Saturday at 4 p.m. for a live broadcast of Founder Talk Show, where we bring in founders, co-founders of startups, where they share their journey, share their startup idea, talk about the challenges, how to overcome that. So today my guest was or is Dr. Akhila Kosuru, who's the founder of Augsidius, a startup that is using evidence-based medical practices. Thank you, Dr. Akhila, for joining us. We hope to see you again in some of our panel discussion.